Hello everybody, it's Melissa Cady, the Challenge Doctor, and just wanted to touch on a note you probably noticed in the little comment that unfortunately keeping patients happy all the time is not a great thing, and there is a tendency right now for a lot of regulatory agencies, whether you're interested in this or not, they go by reviews of what the patients say about visits and how happy they are, maybe about things that are really relevant to the health of that patient. However, any of you that are parents, let me just make an analogy. If you told your child that they can't have that third donut, or they need to go make their bed, or they need to pick up after themselves, or they need to learn how to wash the dishes, or basically inspire them to build up skills and maybe make better choices. If your child took a survey of their parents and in the moment of frustration of not getting what they want, highly unlikely that they would actually rate you with 10 stars or 5 stars, or however you're going to rate an individual. So just as an example, let's just imagine the patient is the child and they're trying to, not to say they are, but if for some reason they're going to get some help from a physician and maybe they're telling them some, especially if it's not an acute type of issue, if they have an acute problem, obviously there's probably something more immediate that the physician or the professional can do for that patient. But just like a child that has a parent, sometimes there's things that it takes time to actually get the results you need. And so when going back to the patient and a physician, there are sometimes things you're going to be told that no, you don't need to have a third round of antibiotics for a possible viral infection, or you don't need to take these pills to deal with your recent breakup. You're still functioning in life, and we're not going to give you these anxiety medications that could leave you, dependent on them. So if someone's trying to inspire you or educate you and give you some skills and perspective and try to help you understand things that might help you later when you come across that problem again, then it might be worthwhile paying attention to. And so for anyone who's a patient or a professional, that these chronic issues or things that develop over time, it's not always easy facing the fact that we might have to do something for ourselves. And let's face it, a professional cannot live with you 24 hours a day, 7 days a week, 365 days a year. So you're actually going to have to put in the effort. And, sometimes it's not your fault, but there are many things that we see in the medical profession that are no doubt related to dealing with stress in life and our basic habits that result from that. So just a little 2 cents on remembering that although the system is veering towards trying to make sure the patient's happy, trying to make the patient happy is not necessarily serving them well, just like allowing your child to have all the unhealthy things or not actually learn to take care of themselves for later on in life. That's not healthy or good for them as well. So I would venture to say that sometimes patients aren't going to be happy with you when you say some of the things they need to hear. And if you're the patient, be open enough to see things from a different perspective and take those things into consideration. And if you're a professional out there, try to hold your ground and try to really tell people what they need to hear in a compassionate way so that they're better served for the future. And that way they're given the skills and a better thought process on how they need to go about dealing with struggles in life. So remember to challenge your health before your health challenges you. And no one else is going to do it. So I hope that you find change within challenge. And we'll see you on the next live video.